Welcome everyone to the webinar. So happy that you can join us today and take a little bit of time to learn more about telehealth and how you can start implementing that in 4 quick steps. All lines will be muted throughout today. So if you have questions, please ask them in the question section of your GoToWebinar navigation panel. That should be on your right-hand side. Also, due to the number of individuals that we have logging in today, we will not be using the raise your hand feature because I'm not able to see everybody's hands raised. So again, if you do have questions, please ask them in that question section. Logistical questions I'll be responding to as they come through, and other questions for our panelists will be addressed throughout the presentation. If you get disconnected at any time, feel free to log back in. And also, the session will be recorded and will be posted by Monday, both in the Member Center of Problem Gambling Network of Ohio's website, as well as the PGNO YouTube page. Today's panelists include Jody, who will be doing the bulk of the presentation, as well as Stacy with the Department of Mental Health and Addiction Services. With all the work that's been happening here recently with the expansion of telehealth, wanted to give you a quick update as to what's going on within the state. So Stacy, you want to take it away?
Thank you, Derek, and thank you to Problem Gambling Network of Ohio for making this happen. Obviously, by the amount of folks that have registered and are online now, there's certainly a lot of interest in making telehealth a reality as quickly as possible. And that has definitely been the goal of both the Office of Medicaid for the state of Ohio and our Department of Mental Health and Addiction Services. While there were limited telehealth opportunities prior to COVID-19 public health crisis, we hope that there are extensive telehealth services being offered now. From the moment it was first brought up, there basically has been a pass in place for agencies to start using telehealth even before the rules were propagated. So we have emergency rules that are filed and I'll say technically in effect. There will be another webinar, there will be a state webinar. At this point, I've heard it'll be Tuesday or Wednesday of next week. But if you are not registered for the for the OMOS news, and you can find those registration sites at mha.ohio.gov, and then you go to the news and events menu button. I think it takes one more click from there, but you sign up for the e-news and then you get the daily announcement. And through that, you'll find out when the webinar is actually scheduled on Medicaid and OMOS's telehealth rules. Bottom line, though, is if you have individuals that you need to serve, and we're talking about teletherapy, we're talking about case management, even screening and assessment, all of that can now be done via telehealth. First face-to-face appointment. So because of the public health crisis, the old rules temporarily suspended. I think it's for 120 days. And there are a couple things that this public health crisis has, I hate to say anything's an opportunity, but everything has some level of opportunity with it. And there are some opportunities around telehealth that we believe will remain after the public health crisis comes to an end, hopefully sooner rather than later. So you would find out more about those specifics again on the state webinar. It'll go over the specific rules. But again, thank you from myself and from the Department of Prevention within Mental Health and Addiction Services. And now I'll pass it off to Jody.
Thank you, Stacy, and thank you everyone for joining this webinar, especially to Derek and Mike. I will ask that Mike and Stacy mute their microphones because I'm getting a little bit of feedback before we keep going. Perfect, thank you. So I'm really excited to be able to offer you information about telehealth. We'll get into a lot of exciting things that you can do very quickly. So as the title states, 4 quick steps to getting started is really what I want to be able to accomplish with you today. So Derek, if you can give me control so I can move to the next slide, or move for me, would be great.
It says you have it, but if you can't move it, then I can.
Yep, you're going to have to go ahead and keep moving it. So I appreciate that.
Okay, you got it.
Okay, next slide. I don't see anything different. We might have a technical difficulty here. There we go. Oh, that's a couple ahead. Can you go back? There we go. All right. Glad this is recorded. We'll always hear the blunders of the beginning of a webinar. So just a little bit more about myself. I'm a licensed clinical social worker in the state of Pennsylvania. I'm actually located in Pittsburgh. I'm also internationally certified gambling counselor level 2 and a board approved clinical consultant with the International Gambling Counselor Certification Board. I am the CEO of the Better Institute, which is a small group practice with 2 locations and 5 clinicians in Pittsburgh. And I'm also serving on 2 different boards, the National Council on Problem Gambling, as well as the International Gambling Counselor Certification Board. Next slide. I might be able to do this from here on out. Thank you, Derek. So a little bit more, some exciting news I'd like to offer to you to go ahead and pull out your mobile phones and text webinar to the number 55444 if you would like to be on my mailing list. We are developing a series of gambling treatment webinars this year. And I'm also really excited to announce that I'm the co-author of a gambling disorder treatment handbook that will be published and ready for distribution in early 2021. So this mailing list will just keep people informed of those kinds of updates. So I promise not to send in too many emails unnecessarily. So really the challenge has been specifically talking about telehealth. It's also called teletherapy or telemental health, telemedicine. You're going to hear a lot of different words. I actually just refer to it as teletherapy for the rest of this webinar. But there's always been a challenge to understand how to deliver effective care virtually. And because of COVID-19, it has forced us to pay attention and find other ways to provide care in an effective and ethical manner. And so this webinar is aimed at addressing these issues. And so I'm really excited to get started. So I think it's helpful to hear this story to give you some hope. In Pennsylvania, my company, the Better Institute, we were able to successfully convert all of our clients within 4 hours of when we had this state mandate to close all non-essential businesses for in-person business. So I can't tell you enough how excited I was to be able to keep delivering services to all of our clients, especially at this time. People need their mental health now more than ever. And so you will learn with calm and confident instructions how to have successful video sessions with your clients. But there are fears and myths about teletherapy. We think about confidentiality, we think about HIPAA compliant, privacy rule, and what does end-to-end encryption really mean? And we've had these fears and myths, which has been why some people have said, yeah, maybe I won't do teletherapy. I'll stick with in-person. And a colleague of mine, licensed psychologist, she's always been opposed to doing any type of teletherapy or implementing it. And I get it. And I would tell her, I understand not everybody has, wants to do it that way. And then with COVID-19, she told me that she started using Doxy.me, which is a platform I'm going to talk about in a little bit with her clients. And I teased her and I said, oh, I almost fell over when I heard you say that. And she said, without missing a beat, in a very serious tone, she said, my patients need me. And so we can really look at how we put aside our fears and myths in a time of crisis, because this is what we do in our profession, is we're there for our clients and our patients. And so hopefully you will, gain a lot more confidence around these areas at the end of this, by the end of this webinar. So we need to kind of review what the definition is. So teletherapy is delivery of mental health services by licensed healthcare professionals, and they're not provided in person. And it is video teleconferencing that allows you to deliver those services and bill for your services. What it is not. It is not phone therapy. I know the word tele throws people off and they think that video and phone might be the same, but they're very different. It is also not to be done in a state where you're not licensed. And so even though Ohio is very close to me geographically, if I were to get a phone call from someone in Ohio, I would not be able to provide them teletherapy services because I'm not licensed in Ohio. And while the internet doesn't seem to have boundaries, we do have some geographical boundaries, even with technology. You cannot record it or deliver your service on a delay. And again, it's not in-person therapy. So what is not HIPAA compliant? We often hear and know very common terms like FaceTime, Skype, or even the Hangout meets with Google. And I want to caution you to resist using these platforms even during this time when things are relaxed, because you can use HIPAA compliant video software easily now, and I would really encourage you to get started the right way. You will also find that if you do use something like FaceTime now while the regulations are relaxed, your clients will have more difficulty switching to another software platform when you have to change to HIPAA compliant. So it's best practices to just not use these right out of the gate. These are the 4 steps that we're going to go over so that you can quickly get up and running. We're going to talk about some different video options, talk about the crisis protocol, your video experience, as well as the client's video experience. And probably for most of us, the most important is how to get paid. What does it look when you do some billing? So let's jump right in with the HIPAA compliant software. Really, what you need from the software is the technology has to have a business associates agreement that you sign. It has to make sure it offers end-to-end encryption and has secured site and data centers. Ultimately, what you'll want to do is change your informed consent so that you include the HIPAA compliance for any software platform that you use. And you're going to want to include some sort of a client consent for teletherapy. We're going to talk about the crisis policy. You'll want to go back when you have a little bit more time and make sure that your written crisis policy now includes being remote. And I always recommend that everyone install antivirus software on their computer. So video software. So let's look. Now, there are hundreds of products out there, and what I wanted to do is just go over some that I think are very easy to remember and give you some of the terminology. So if you want to compare to other products that we don't cover in this webinar, you'll have a little bit more confidence in what to be looking for. So we're going to go over what Zoom offers, Doxy.me, and WhatsApp. And then the last one is really a full practice management software if you were to convert your entire practice into cloud-based. And I'll just briefly touch on that one. So pretty much everybody has heard of Zoom. You probably with COVID-19 have been on more Zoom meetings than you ever thought possible. And when you first go to their website, this looks really appealing because what you see is the word free. We all want that right now, but I want to bring your attention to where the arrow is, because the free version and the things that are listed on this web page, none of these Zoom products are HIPAA compliant. You need to go to the web page that says Zoom for Telehealth. And when you do that, you see immediately that the telehealth version of Zoom is $200 a month. And you might be saying to yourself, oh my gosh, that is really expensive. So when you click the Buy Now button, what you will see is the telehealth that's HIPAA compliant starts at 10 providers. They say hosts, but it's really, think of it as 10 providers. So you're looking at about $200 a month for 10 providers. So that's about $20 per provider per month. Now, obviously, that can be very expensive if you don't need that many licenses, but it can be actually relatively cheap if you're in a small group practice or an agency setting or even multiple locations when you have more than 10 providers that you want to provide software for. This is also, Zoom is what I would recommend if you want to keep all your other procedures and processes in place. You might have another way of doing your documentation, obviously other ways of doing your billing, and all you want to do right now is drop in the video component. This is a great solution to consider. Again, it depends on the size. So what if you are smaller than 10 and maybe even just an independent provider? So here, Doxy.me is a great solution. It's been around for quite some time. You see the word free a couple of times, and it actually is free. It was designed, as you can see by the terminology where it says telemedicine, it's up in the top, it says for patients. So it tends to have a little bit more of a medical tone to it than maybe a therapeutic tone. What they're offering here is the free version, or you can start to pay for the version. What happens though is there's always going to be differences between the free and the professional. It could be a variety of differences that include better support. It might offer some other features to the client, maybe text reminders or email notifications, maybe even better video quality. But again, if you want to get up and running as fast as possible, you can do that with just doing the free version of Doxy.me. When you go and you click on all these features, what I'm just drawing to your attention is take some time to go to their website. And in this middle panel of the screen, I've highlighted the call features, but notice there's several other things that you can click on to compare the differences between the free version and the paid version. I know several people already that have started using Doxy.me. It has a virtual waiting room. And so that tends to be something that's really nice if you don't always stick to your calendar and you fall behind. That virtual waiting room really does give the same atmosphere and appearance to the client as if they were waiting in your physical waiting room. This is also really helpful to have that virtual waiting room because clients will log in and they actually think and expect to see your face right at the top of the hour or whenever the appointment is scheduled. And if you're running even 1 minute behind, notice how that 1 minute can seem like a long time, and then they'll think maybe that they did something wrong and they might exit out of the product or something like that as their first experience. So having a virtual waiting room can really make all the difference in the confidence with your clients as they shift from in-person to video. So I like this product a lot. If you do start to have any delays, remember that all people across the globe are starting to figure out how they have to offer services remote. And so a lot of these software companies got a lot of business and a lot of demand that they might not have been prepared for. So there might be peak times of the day where a free product might not work as reliable, and that tends to be when you make the decision, do you go to a paid version? But just things to really think about in terms of your long-term goals and business strategy, how long you want to implement and maintain a teletherapy practice. So then we move on to WhatsApp. I don't know if many of you have ever heard of WhatsApp. This is a really great solution when you have clients that you don't even have their email addresses. Because notice, like with Zoom and Doxy.me, it does require an email address to send them a link to click on in order to be able to have the video experience. But WhatsApp has been used, and from day one, it was developed to have end-to-end encryption and security. It's pretty much what they brag about. And a lot of people know this internationally. This seems to be a really hot product internationally. So this is a great solution for when you don't have people's email addresses, or you have clients that don't have a computer or a tablet. They might only have a smartphone. So this is the perfect way to connect with them. So what this means is that if you use WhatsApp, you're also going to have to use your tablet or smartphone. You won't be able to use the desktop version. So let me go into that in a little bit more detail. On their website, they're very proud of their privacy and security, so you can read a little bit more about this. But as I stated before, everything about the video experience is encrypted with their end-to-end. So this is very reassuring. Their website also kind of misleading, shows maybe that you can download on your computer, but you can't do that for the video experience. It's only for the chat experience. So if you're going to use WhatsApp, you're going to use your smartphone to your client's smartphone. Really good story that made me go, wow, no wonder this is a great product. A colleague of mine, she was called in to deliver services remotely to a school district. This was about a year ago. And the school district really had to decide what was the best way to connect by video for this student to this therapist. And they decided WhatsApp, mainly because of the end-to-end encryption and HIPAA compliance, and because this was a younger student who didn't even own any devices, and the school district was able to just use a Wi-Fi enabled tablet to allow for that experience. So you have a couple different audiences that you might think which platform, which software would be better for them. And I would say that, again, anyone that maybe doesn't, maybe lower socioeconomic, that doesn't have multiple devices but has a smartphone. Maybe some older adults might only have a smartphone, and definitely adolescents. So if you work with a lot of adolescents, WhatsApp might be the best platform to use. And last, I just wanted to quickly show you, this is Simple Practice. I'm not endorsing this product over any others. I'm just going to show you how you can compare and contrast. The key here is, if you're going to just completely convert to all-inclusive practice management software, really good for independent and small group practices. So here's a little bit more from their website. As you can see, it manages everything: scheduling, the documentation, billing, managing insurance, and as you can see where the arrow is, it also includes the telehealth component. So this requires quite a bit more setup to be fully up and running. But if this is something you're considering for your long-term business strategy, you could probably sign up now and get started with your client's email address and the telehealth portion right away, and then phase in all the other things that go along with implementing an end-to-end full practice management software. This one is going to be a little bit more expensive because of what you see here being all-inclusive. So I would probably say you might be around $59 to $60 per provider per month for a solution like this. I did have a colleague tell me recently that they might as well just go ahead and get started with this, because until they could really get up and running again doing telehealth, they had a lot more time on their hands. So that might be another way to weigh the pros and the cons of doing this. But this is the product that I said we were able to convert all of our clients within 4 hours, all to 100% tele, virtually without any difficulties or any barriers. So lots to think about here. So I'd encourage you to go visit their website and kind of look at all of those things. So from the video experience, you have several choices to just drop in video and keep everything else about your business the same right now. And so you just have to decide, is it something you might do on a desktop versus a mobile app? And then are you going to use a paid or a free version? Okay, so hopefully if you have any questions related to those, put them in the question box and I'll be able to answer them. And then we can also do any questions towards the end of the webinar. So the crisis policy, let's talk about what the purpose is. We've all had a written crisis policy for what happens when we have our client in our waiting room or our office and what we would need to do. And so you got to go through that lens and think about, what do you do for a crisis policy when you're remote and you aren't right there with your client? So here are some quick recommendations. You want to review steps to take with your client if they become suicidal or homicidal, have any psychotic symptoms or other crisis that you can't resolve remotely. So you're going to want to make sure you have your 800 numbers posted. You want to talk to your clients and make sure that they have that 800 number. I've actually encouraged my clients to program numbers into their phone for if they were ever in crisis. So it's not just about when we're on a video call. The other purpose is to designate an emergency contact person. And there's a lot of talk about this. Ultimately, you want to get a release of information for this emergency contact person. However, by definition, you don't need one if you have to contact them for a life-threatening reason. Maybe they need a higher level of care. And so I've documented with my clients who they have as their designated emergency contact person. And I've also documented the name of the nearest hospital to them, as well as the name of the nearest police department. The reason for this, it's not as big of a deal when you think about your current clients, because they generally are in the same geographical region as you, and you might actually know the hospitals and the police departments. But what happens if you get a new client that might be 2 hours away, still in your state? You won't know the name of the hospital or the police department. And so this is an opportunity to make sure that you have captured all of this in your client's file, should you ever need it. And so while crisis, is something we really always hope to avoid, this is how to be the most prepared. If you're in an agency setting, make sure everybody gets together and you kind of have your protocol, designed and everybody understands it for working remote, so that there aren't any confusion about what to do when that happens. Oftentimes these policies would include when to get a hold of the supervisor and things like that. So shouldn't take you too much time, but right now, while you're talking to your clients, collect this information and make sure it's in their file. Okay, so one of my favorites is the video experience. So you eventually forget that you're on video because it really does start to feel very similar to in person. And most clients will settle into the video experience very quickly. So what I want you to do is just remain calm and confident as you're getting up and running. I joke and I say, we know the saying, fake it until you make it. Clients understand that you're not necessarily, experienced at this either. And so, just you get to show your human side and they really appreciate that. But typically my standard slide is to talk about what teletherapy is suitable for and who it's not. Obviously with this temporary crisis, it's suitable for as many people as possible. But you are really assessing to make sure people have internet and some device, as well as a camera and a microphone. If you have clients that do not have those, then if you're doing any remote services right now during the crisis, you probably would have to go back to telephone sessions. Ideally, people will have a basic knowledge of how to use the technology that they own. And obviously, I talk about this all the time about when people are not able to attend in person for any reason, and especially near and dear to my heart is with problem gambling. We know there's a lot of individuals when they're in early recovery that money is a big issue. They might not have reliable transportation. They might be working a job and a half. So the commute to and from is cut down by doing teletherapy. So there's lots of opportunities to really use this with the problem gambling population. We do want to assess when it's not suitable, if people are at risk for harm due to a serious mental illness, or they are not able to access technology in a private space. I mean, that again, we talk about confidentiality is going to be important. During this crisis, we've got everybody at home, piled on top of each other sometimes. And so I can tell you, I've seen the inside of people's cars quite a lot in the last couple of weeks because they just took their smartphone and they went to their car, and that's the most private space they had for that 1 hour. And it works really well. So you just kind of go with it. So how do you start and how do you end? So there is a little bit of anxiety starting a video session for the first few times, and how do you end? These are some of my strategies that have worked really well, obviously converting everybody 100% to virtual in the last couple of weeks. I've actually just taken the time to congratulate them for successfully connecting. If it's their first time connecting by video, I will take the time to call them on their phone first, make sure that they can locate the link that my software provides, any troubleshooting until we're both on video, and then we both hang up the phone. And then I just say, you did it. This is wonderful. Congratulations. I really also thank them for committing to their mental health now, because it's just more important now than ever. And people, I've had people that have said, I don't know, I was thinking I was going to cancel. By the end of the session, they say, I'm really glad I kept my appointment. Thank you. Wear headphones. And I remind them to wear headphones, because this is a great way to help protect confidentiality. If they're wearing headphones and they're talking and someone is in another room, all they hear is what they're saying, not what you as the therapist are saying. And so I really encourage that whenever possible. Develop an agenda. People are not sure how to convert from in-person over to virtual, and so when you kind of talk about an agenda, what would you like to talk about today? Especially during this time, people have a lot of anxiety. Give them permission to talk about COVID and maybe the things that they're listening to or how much TV they're watching, and use that to make a therapeutic transition into what maybe are better practices for them to limit social media, not be focused so much on COVID-19. And then they start to realize this is a therapy session again. This isn't quite like a phone call with a neighbor or something like that. And ending the session, you're going to have to be really mindful of the time and be able to say to them things like, we're getting close to the end of our time. We have 10 minutes left. I want to make sure that we are able to close. I want to schedule your next appointment. Remind them that it's going to be virtual until later notice, just so that they don't think virtual is just once and then they go back to in person. Thank them for a successful video session. It's a great way to really help people when you're working on their self-esteem and self-confidence, to use this as a way to show that they really accomplished something. At the same time, you're going to have to practice your own self-care and make sure when you're scheduling your clients that you schedule time for comfort breaks, as I call them, because you can get back to back and people are starting on the hour, and if you can't get the previous client off the call soon enough, all of a sudden 3 hours and you haven't been able to have your own comfort break. Think about what we do when we're able to let our client wait in the waiting room while we take that comfort break. Think about how you build that in now when you're doing this virtually. So best practices, I can't stress enough, always, always, always start on time and end on time. It's very different when people log into video and there's nothing there greeting them. And so these are, and it's a great way to really help people that might be late for their own appointments to start realizing how to be on time. Always look in the camera frame. I know that sounds kind of odd at first, but you have to realize you're actually going to see yourself all day in this camera frame. And so make sure you have a clinically appropriate backdrop, something not too distracting if possible. Again, we're all just doing the best we can during COVID-19. I've seen a lot of people say, my work office is clearly much nicer than my makeshift home office. But do what you can to make the backdrop clinically appropriate and not distracting. There's that emergency protocol. Make sure you review it if you need to. Show your gratitude for keeping their appointment. People will be more likely during this time to want to put something off just because it's new and they've already experienced so much change that little things feel very overwhelming. So we really want to make sure we take the time to thank them and make sure that they have a really good video experience so that they'll want to schedule another video call with you relatively soon. Some people might say, how about we talk when this is all over? And so really try your best to keep them connected and eliminate any disruptions or interruptions. I know that, everybody working from home, there's kids, there's dogs, there's, cats, there's all kinds of things going on, but just try and eliminate as many disruptions as you possibly can. Keep your phone on silent, close the door, all those kinds of things that you can do. Okay, so what is so important is how do we get paid for this? Now, what I'm doing is I'm going to give you an overview of insurance reimbursement, and then I know that there's a couple other people that can be on the call that can speak more specifically to Ohio's reimbursement. So please don't view me as the expert on all things Ohio. But what we do know is that national plans have been reimbursing for teletherapy for quite some time now. And so we're really excited to be able to say that Medicaid is responding to this crisis with reimbursement provisions and also Medicare. And so Medicare, from the latest that I have read, is that they're relaxing the requirements so that it's not just for areas that are called metropolitan shortage areas. Everyone is able to do teletherapy during this time. It is also our opportunity as a profession to not give it up when the crisis is over. Use this as opportunity to get Medicare and the Medicaid to be able to continue to offer this service. Clients, once they do teletherapy, majority of them really like it and want to keep doing it. And it has a great impact on reducing no-shows and cancellations. But just to give you an idea, with Medicaid before COVID-19, there were several counties in California that had to do direct to consumer, provide Medicaid benefits to their members by video. And they did this because they didn't have enough providers. They were rural areas. It was a behavioral health provider desert. And so they actually have been doing this for quite some time with great success, which does dispel a myth that Medicaid members can't afford technology. It did show that they actually do have technology in today's times. So things to think about. But the all important, how do I get paid for this? So it's very similar to how you do billing today. You always have your dates of service. And for those of you who are used to doing billing on, this is an example of like a HCFA form, your place of service. You have your CPT code, typically the ones I have listed there, the 90791, 90837, or the 90834. Those are the most common. Your place of service oftentimes was number 11 that equaled the office. And so many insurances now have a place of service 02, and it stands for telehealth. So Again, this is going to be a little bit of trial and error depending on some of the providers that you or payers that you work with. You might have to do O2 and then your 90837, and then no matter what, you always use the modifier GT, and that definitely signals that it was a teletherapy session. There are some payer systems that are so large and have so many different databases that are trying to talk to each other that sometimes place of service doesn't always translate. But it is universal that GT does translate. I just checked a couple days ago with some briefs about Medicare, and they said the same thing. Make sure you use the modifier GT. And so I know that that holds true with Medicaid as well for many. So here's an example of a finished claim, O2 and then 90837 with the modifier GT. And so if O2 doesn't work, then you would switch it to 11. So what I recommend is that you reach out to your insurance providers. Hopefully they'll have things on their website related to this, but whatever you can do, just kind of clarify if they're looking for an O2 or an 11. And again, always put the modifier GT. There has been some discussion about maybe some documentation suggestions. I'm only going to give these as suggestions. I would really encourage you, especially if you're in a small group practice or a larger agency, to come up with a policy related to this. But I think it's really important for those payers that are relaxing their requirements during COVID-19, that in your documentation during your teletherapy session, you indicate something like that. So, you know, again, it could just be one sentence that says something like, you know, met client via video during the COVID-19 mandate or COVID-19 shutdown for an individual session. So anything that can identify this time in history when you go back and have any type of reviews or audits with your charts. So again, get together and talk through this and come up with maybe a one sentence and then just use it as standard documentation that you begin with. And here is, we have all kinds of resources for Ohio. The reason that we made this webinar fairly short and to the point is because we know that things could be changing down the road, and we just wanted to actually get as much information out to you now so that you could get up and running and provide teletherapy for your clients. So at this point, I'm happy to take any questions that might come through, and I'm not sure if any of the other panelists have questions or want to add to this.
Great. Well, thank you, Jody. And if you do have questions, please ask that question in the question section of your GoToWebinar navigation panel. Also, you'll see in the chat that I shared out some resources specific to Ohio, and that will also be part of my follow-up email that we'll be sending out hopefully on Monday when the link to this session is recorded and up on our YouTube channel. So as you are typing in those questions, I think some people are dialing those in. Wanted to let you know about PG&O and the membership. We are a membership-based organization, and you can become a member to network, get regular updates, as well as other resources that are happening. Also wanted to direct you to pgnohio.org/events. So this is where we post events such as this webinar. We also have monthly supervision calls that we offer through support from Department of Mental Health and Addiction Services. So if you're a gambling counselor and looking for those supervision hours, then we've got those calls set up. And I think that's a typo at 626 on that last one. And you can also follow us on our various social media channels at Facebook, Twitter, and LinkedIn through PGN Ohio. That's the way you can find us there. Question from Ashley. Jody, do you have a suggestion for a platform for a smaller nonprofit and or peer supporters?
Yeah, you know, I mean, it really just depends on your budget and what you're trying to do. So if you're just trying to drop in the video, that's kind of why I mentioned Zoom as a great way, because it just sends a link to clients. And if it's something that you can't afford, then I would definitely look at DoxyMe or the WhatsApp or something equivalent to that. There's a lot of different practice management software programs out there. So Simple Practice is just one. So you could probably just look and Google all the different names, just do a comparison based on price. But there's just so many, and so many are so good. So hopefully that helps.
And this question from Rachel is, are there any additional considerations for problem gambling clients?
Ooh, that's a good one. I know myself, the last couple of weeks, I have been working, with several of my clients virtually, and and I've done about 40% of my clientele prior to COVID-19 was virtual, and most of them are problem gamblers. The video is really helpful because it does really reduce a lot of the travel time, worrying about gas for their car or getting a ride, fitting it into their schedule. Sometimes they can find an hour, but finding an hour and 45 minutes isn't easy. So I know that that's been very helpful. And just, the tech alone, a lot of my clients were online sports bettors. They're very comfortable with the technology. And so by doing video, they're still engaged in technology, and I believe in a more productive way. So those are some of the things that I have found to be very helpful, specific with problem gamblers.
And Sheila asks, have you run into any problems with people running out of minutes for their cell phones?
I haven't. The whole notion of Wi-Fi is, a lot more people do have Wi-Fi. I had one time a client that drove to a hotspot where it was free Wi-Fi, but they sat in their car. I know a lot of plans now are unlimited and not that expensive. And so again, get curious with your clients and have that conversation, because then you're able to really problem solve what would be the best solution.
And this question from Sherry, when using a video/telehealth session, can you pick up on body language?
You actually can. You'd be surprised how these cameras I have actually a pretty old computer, and I'm surprised at how high def it is. And so it zooms out a lot more. It's not like it's just their face and it's cutting off their chin. The body language also, you'll get a lot more with if they're using their mobile phone, because they tend to move it around a lot, so you can see a lot more. But you definitely will see the body language, the shoulders, the turning of the head, the eyes, everything you would see in person. You're just not going to see how fidgety their legs are, or if they're crossing their legs all the time. So it really is, you're not missing out on that much, given how much more you're able to do just by providing video. And I'll probably add to that, I know that some might want to prefer to do phone. And I would stress at all costs, convert people to video as quickly as possible, because when people are on the phone, they actually start to multitask, and they're not really that focused and paying attention to the session. But when you're on video, you can't do anything else. You have to stare at each other and have that meaningful conversation. So that would be my 2 cents on the phone whenever possible. I do have some people that just don't have technology or strong signal, and so we do phone at this time because I see them in person otherwise.
And that is one thing that after Stacy left, she texted me to make sure that I mentioned to all of you, is that even though the overall focus right now is just see clients, so if you have to do phone, just see clients. But then she also, with the HIPAA piece right now, reminded folks that it's acceptable currently to use Skype and FaceTime. But again, if this is something that you're taking the energy and working in now, would be a good piece to then work beyond. this crisis with the teletherapy that you set up now, which fits in perfectly with a question from Deanne. Deanne asks, my IT department purchased the version of Zoom that allows unlimited participants and unlimited time, but I'm not sure if we checked Zoom for telehealth. Do you know if we could convert that if we've already purchased the convert that to the telehealth version?
I do know, absolutely, because any business will take your money for sure. I also know that they might have a backlog if you need to talk to someone, so do the support online or a chat online as a way of getting that answer. I wouldn't wait to try and talk to someone in person. A lot of these vendors are really inundated with requests to get up and running. So you probably don't have the HIPAA compliant version, but it would be worth getting that started. And again, if the time is that this is relaxed HIPAA requirements right now, if you still used your current version of Zoom while you were in process of converting over, it sounds like everything's okay. And it operates the same from the client experience.
Thanks, Jody. And question from Jennifer, will the slides be available? And it's up to Jody, but we can certainly send out a handouts version of the slide. And
Sure.
I can work with Jody offline after that to have that in the follow-up email. So thanks
Absolutely.
for that question, Jennifer. And this question from Kenneth, can you repeat what you did not like about FaceTime, Skype, and Hangout Meet?
Yeah, well, what I don't like about them is that they're not HIPAA compliant. And so what happens is even if you take advantage of using them now, your clients are then going to get comfortable with that. And then when you convert them to a HIPAA compliant software, it's another change for your client. And so I'm all about minimizing as much change as possible, especially when people are still dealing with all of the change in our country. So they're just not HIPAA compliant, and the client gets really, they're creatures of habit. They get used to one way of doing something. So try not to switch it up on them a couple of times.
And thank you from Kenneth. Those are the questions that I have in the question queue right now. Again, if you do have a question, please ask it in the question section of your GoToWebinar navigation panel. And heading over back to the chat to see if anybody's chatting it up. And I've not seen any chats. So that's all that we have for now. We thought you guys would have more questions and be chattier. So if you're not, that's okay. Hopefully your needs are getting met. Oh, here are some questions. So this comes from Faye. If I go with Doxy, does my client have to download the app on their device as well?
If they're using a mobile phone, almost always you would have to download an app. And the reason is the app is what makes the end-to-end encryption HIPAA compliant. And so that's again why any app that's already installed on a smartphone doesn't necessarily mean it's HIPAA compliant. So they would have to download if they're using a mobile device. If they're using a computer, there isn't anything to download. It's just in a browser, and they click and they're right there.
Thanks for that question. And this one comes from Tanya. I am a social work intern who is not tech savvy. Please indicate what, in your opinion, is the best practice in using the which product to use.
Yeah.
The best practice.
Yeah. Again, go back to what's your population, the people that you're serving. Do they typically have computers, or do they really only have one device and it's a smartphone? That's where I would start first. If that's the case, then I would do WhatsApp as kind of the drop-in video. You both download the app and it actually connects rather easy, but you can always test it with a colleague, or you have my contact information from this webinar and you can always test it with me. I use WhatsApp a lot, so not a problem if you want to test with me too. That's actually not a bad idea to play around with it with another colleague before you implement it with a client. The second thing I would say is nobody has to be tech savvy to use these products. These things are so well designed and just so virtually effortless is what I like to say. Doxy.me, I had my doctor had to convert over, and she was really nervous, and she said, can you be my first patient that I see with Doxy.me? I said, sure. And she's like, I don't know what it's going to look like. All I got was an email with a link. I clicked on it. It said I was in her waiting room. She clicked that she was ready to join, and there we were. So these things are really well designed, and so you don't need to be tech savvy, and don't let that bother you. The tech just makes it so much easier for everyone.
And Julie Hyden says, thanks so much, Jody. This is such incredible information. Thank you, Julie, and thank you, Jody.
Thank you.
This question from Bill, does Doxy.me have an app?
Yeah, again, it's good. If you're using a mobile device, it would have an app just to create that end-to-end encryption. And even my product, Simple Practice, if it's just a browser, you don't download anything. But if clients want to use their phone, they're prompted to download an app for free that Simple Practice created, because that's how they ensure end-to-end encryption. But all of the downloading is free. Did you want to talk about the next upcoming webinar?
Yeah, I muted myself, so let's try that again. Jody, since we're waiting for some additional questions, would you like to talk about the upcoming webinar, Teletherapy, Keeping Your Clients Engaged?
So what we were thinking with this webinar, and also based on the questions from today, was, now that you've started with software and tested out with a couple clients, what are some of the other tips and strategies in converting how you do things in person to how you would do them virtually? And so we'll cover how to keep your client engaged during that session, where you're used to maybe writing notes or having them write something down, or you're used to handing them something. How do we convert all of that virtually so the client still gets the same or similar information, just packaged a little differently? There's also some things that we can talk about in terms of, making sure that this session, they're not distracted with, where they are, people behind them or anything like that. And just other strategies that you might want to kind of work through. I would really want this next webinar to have a lot of active question and answer to really talk about all the things that can happen when you go virtual.
And to register for that webinar, you can go to pgnohio.org/events, and that's listed with all the other events that we have going on. And Jody, is there any way we could be provided with a sample telehealth policy and procedure, as well as client consent for telehealth consent?
Wow, that's a really good question. What I will do is I will download the telehealth procedure that comes with Simple Practice, and as part of the handout notes that Derek will be posting, you will get a copy of that. Really, all you need to do in your informed consent is to talk about how you can deliver services using teletherapy in a HIPAA compliant manner, using HIPAA compliant end-to-end encryption software. Just like you would explain to them that you perform services in person at your office, that type of thing. So we will go into a little bit more detail on that at the next webinar, because there's a little bit more work you have to do, and today's focus was just get you up and running as quickly as possible. Your informed consent also needs to inform them of the risks. And I always giggle about this one because, what are the risks of using technology? It's really hard to answer. There are not that many risks. The risks that we have to think about are more about that crisis policy and what happens if they need a higher level of care. They're not, medically stable, or, with their mental health symptoms not as stable for the current video experience. What do you do? So those are really more about the risks than anything. And some people just are not going to be appropriate for video therapy long term, as a way of, seeking services. And you might just want to call that out depending on the specialties that you have in your practice.
This question from Patrick: are all boards in support of telehealth? Mine has been resistant in the past. Jody, I will take that question and say yes. If they want to continue to receive funding from Department of Mental Health and Addiction Services, they really are expected to fully embrace telehealth services, at least for now. Hopefully this will also give you that time to get a structure set up in place, and hopefully the webinar on the 17th will help further get you moving in the right direction. But from the Ohio County, OACPA, Ohio Association of County Behavioral Health Authorities, Sherry is on a call every Monday, Wednesday, and Friday with me and other stakeholders, really talking about this issue. And it's really very clear at all levels that teletherapy should be offered as soon as possible. So that's really what led us to get this webinar tossed out here, and hopefully getting you the resources you need to get started. Sometimes we'll be in a situation where we need to kind of build the bicycle as we're riding it, and that's kind of where we are now. But it's just imperative that we connect with those that need the services, because many organizations aren't taking clients. After taking these webinars with you, will this satisfy our certification requirements with our board? This question's from Faye, and Faye, this is completely independent. So check with the board. We are certainly willing to share the recording, the handouts, and any other pieces that you might need. We've not gone after continuing education for this. I looked into it, but the board's currently processing continuing education hours. It takes about 40 days, and that would be too far down the road for these needs. So the short answer to your question, Faye, is I'm not sure. Check with the board. If you have questions, or if they have questions, feel free to call me, and we'll be happy to work through it with you.
And I would add to that.
Oh, yeah, Jody.
I would add, find out what it is that they, are really looking for, because oftentimes it's to make sure that you understand, what's HIPAA compliant, what's end-to-end encryption, what's a BAA. It's those type of terms that they're looking to make sure that you learned. And so we'll review those again on the 17th of April, just like we did today, but I'll go into a little bit more detail on the 17th.
Yeah, and Faye, if there's additional pieces that your board will expect you to have, if you could send that to me, then I can work with Jody to incorporate it in our session on the 17th. Question from Bill: does any of these platforms have group capabilities?
That's a great question. I know that Simple Practice will allow to have multiple people dial in, because they're doing that to support couples. And ironically, we've done some couples counseling where people were in two different locations at the time of the appointment. To effectively run group, I would do Zoom. If you had to pick one, Zoom manages multiple people very well. And if you have no more than 10 or 15, the screen doesn't get that crowded. And so I would recommend using that if you want to maintain your groups. I do know that there's a gambling support group that Jeff Wasserman out of Delaware has been running, and he recently converted over to Zoom. He was using Skype for Business. Skype for Business changed its name. It's under the Microsoft product of Teams, but the Skype for Business was HIPAA compliant. I could not find anything that said Teams was HIPAA compliant. But again, you know that Zoom for health telehealth is definitely going to be the thing you can do for groups.
And this is a great time for everybody to learn. David has written in that Zoom does groups. VC does them as well. And he has had 25 people in his Zoom. So there you are.
Yep, perfect. Thank you for sharing that.
Well, that is all the questions that we have for now. Jody, any last things you want to mention before we wrap it up today? And if you, audience, have any last questions, now is your time.
I just want to really thank you for putting this on and doing this in such short notice. It really speaks highly of the organization and what you're able to do for the providers in Ohio. This is our time to collect as much data as we possibly can about the success of teletherapy, so that if there's any discussion about removing this feature with any of the payers, the data will speak loud and clear. So anything you can do now to collect that data, I'm just preaching over and over in every state. I mean, if Medicare lets us do it now, that's a huge ship to try and move quickly in the ocean. I want to keep that going and not let them take it back.
Thanks, Jody. I'm seeing a lot of thanks so much. Thank you. Great information. This was great. So well done. Thank you, Jody. And hopefully with all those wonderful comments, that means that you audience members will be joining us back here on the 17th. Hopefully you enjoy the rest of your Friday. It's hard to keep track of days when you're always in the same place day in and day out, but today is Friday. Yay. So go out and celebrate, enjoy the time together with your family, and we hope you'll join us again on the 17th. Thank you so much, everyone.
Thank you.